Jade, it's very nice to meet you, and I look forward to hearing more about your condition and your skin needs. But before we do, why don't you tell us a little bit more about yourself?
I love the outdoors, but because I work about 16 hours overtime, I don't really spend much time outside. I love traveling though, so yeah.
Okay, so
that's me.
A hard-working traveler,
yes,
essentially. Well, Jade, tell me, what is it that you have a concern with your skin?
I have eczema on my face, my back and my arms. So that's my concern, as well as pimples and blackheads.
Right.
So, and the dark rings around my eyes. I'm trying to get rid of all of that, but it's pretty difficult if you have eczema.
Right, and you've had this since you were born?
Yes.
Right. For the management of your eczema, what products are you currently using on your skin?
I am using cortisone with Vaseline, so I'm mixing the two to help.
All right, so cortisone is a cortisone.
Yeah.
So you're applying the cortisone with a thick base to try and help bring relief. Now, importantly, understanding what that's doing for your skin. The cortisone is trying to suppress the inflammation, and the base that you're blending it in is acting as a temporary barrier on the surface of your skin. Now, we have some challenges there. The barrier, as I said, is temporary. It doesn't stay. So the minute it gets wiped off or you bathe, it's gone, and you have to reapply the whole thing. The cortisone, although very effective to reduce the inflammation in your skin, has long-term negative effects on your skin.
Yeah.
In that it prevents collagen from being made. In fact, it can accelerate collagen breakdown, which can make the skin thinner. It can also cause tiny little blood vessels to start dilating in the skin, which you will eventually start seeing visibly. So the idea is for all patients with eczema and atopic dermatitis is to try and help them wean off the steroids where possible. Of course, flares happen, and those patients, much like yourself, I'm sure, would have to go back on to cortisone for a period of time just to keep the flare suppressed. However, what the focus has been now more recently for patients with this condition is to provide a substitute for that missing oily layer or lipid layer. Not to put a temporary barrier on the top, but actually replace what's missing.
Okay.
Now that absorbs down into the upper layers of the skin and acts as your own barrier. In fact, it even mimics the shape, the form and the function of a human natural barrier. So there are many things that we can do to assist you in this regard. And I think what's important as well in the bigger scheme of skin care is to be quite aware of the fact that there's certain professional treatments or home treatments that you really should not be using for very simple reasons. Firstly, exfoliators. Any form of exfoliation on your skin at this point is probably a really bad idea. Have you experienced that?
Yes, I bought something 2 weeks ago to help with the blackheads, and it burnt my skin.
Right. And again, just remember what's missing is you have no barrier, in theory. So anything you put on goes in. And exfoliators tend to be acidic. I'm not referring to the granular exfoliators that will just, unfortunately, in your case, make the barrier condition even worse. So stay away from exfoliators. It's a terrible idea. Strong soaps and detergents would obviously make your condition a lot more uncomfortable. What I propose is that for your condition, don't stop what you've been prescribed by your dermatologists, but at the same time, I think we can find a way to better build your barrier that gives you a more long-lasting protective effect on your skin. I'm really, really excited to see your improvements. I think you've had a really tough go of it, and I'm confident that our technologies will be able to assist you. I really hope to bring you some relief.
Thank you.